Welcome to another Capital Live event brought to you by Spotlight PA. We are in the midst of a frustrating vaccine rollout in Pennsylvania, and that might put it lightly for some. This has primarily been driven by a short supply of vaccine overall, but making matters worse, however, has been the state's patchwork system for finding and getting shots, which has been a major source of public complaint. Hanging over all of this is the continued news about new coronavirus variants, new masking recommendations, and what it all means for living our lives and at some point, fingers crossed, getting back to normal. So what better time to spend an evening with some of the state's leading doctors and health advocates to cut through it all and get to some answers. I'm so happy you could join us this evening, and welcome to the conversation. I'm Christopher Baxter, the Executive Director and Editor-in-Chief of Spotlight PA. For those of you who don't know, Spotlight PA is an independent, nonpartisan newsroom that covers the state government and urgent statewide issues. We don't charge for our journalism. In fact, we share it at no cost with more than 60 newsrooms across the state, helping keep Pennsylvanians in all corners informed and empowered to hold their government and their elected officials accountable for their actions. But while our journalism and this event are free, they are certainly not free to produce. Unlike most other newsrooms, Spotlight PA relies exclusively on institutional grants and the direct support of our members. In advance of this event, you are asked to contribute what you can toward admission to help us keep this kind of public service programming free for all. And I want to give a big thank you to those who have contributed so far. Michael H., Karen G., Jacqueline A., Jack C., Sue A., Robert S., Audrey L., Angela M., Forrest S., Dennis M., Donald H., Stephen V., and a few that have come in just the past couple minutes, Eleanor C., Jane K., Henry I., John S. Thank you all very much, and a big welcome to you all for being new members of Spotlight PA. Also, a big thank you to all of our current members who are already doing their part to support Spotlight PA's essential work. And finally, a request. For those of you who are able and have not yet contributed what you can to attend today's event, please go to spotlightpa.org/donate now or after our event and become a member. This is entirely an honor system, and we rely on your support. Thank you. On to a few housekeeping items. Thank you all who have sent questions in advance. And while I wish we could tell you exactly how and when you can get the vaccine, unfortunately, we don't have any more insight into that process other than to continue to contact your providers listed by the state and check for availability. We know there's been a lot of frustration around that process, and we'll talk a little bit about that. If you have not yet asked a question, you can still do so. You can use the Q&A feature right here in Zoom. To do it, simply click the Q&A icon on the bottom toolbar and type in your question. I will moderate the questions as we go, and we'll get to as many as possible. But we have had a lot, not surprisingly, and we won't be able to get to all of them, but we'll do our best. Second, we're recording today's event, so those who are unable to make it can catch up later. We're also really excited. For the first time, we're live broadcasting this event on Berks Community Television, so a big welcome to our viewers in the greater Berks County area. Last but not least, I'm really excited to introduce our panel of experts joining us this evening. I'll introduce each of them, and if you could just give a quick hello and introduce yourself and your work, that would be great. First, we'll start with Dr. Frederick Bushman, a professor of microbiology at the UPenn Perelman School of Medicine. Good evening, Frederick. Thanks for joining us.
Thank you very much. It's a pleasure to be here. Research in my laboratory focuses on viruses, virology, how they grow, how they make people sick. And we've been doing a lot characterizing the viral variants in the Philadelphia area in recent months. And I can tell you a bit about that.
Wonderful. I look forward to that. I know myself, I have a lot of questions about that. So thank you. Next, we have Eric Keel, the Director of Policy and Partnership at the Pennsylvania Association of Community Health Centers. Welcome, Eric. Tell me a little bit about what you've been paying attention to.
Thank you very much. We represent more than 300 FQHCs, health centers across the state, and we have been with the first case of COVID in the state of Pennsylvania was found at one of our FQHCs up in Wayne County, and that has been our focus the last 10 months is COVID testing and contact tracing and now vaccine distribution.
Wonderful. Great to have you as part of the conversation. Thanks for
Thank you.
taking some time out. I know you're busy. Next up, pleased to introduce George Fernandez, founder and chief executive officer of Latino Connection. Welcome, George. Thanks so much for being a part of this conversation.
Thank you, Chris. I'm currently sitting in a rooftop in Miami, so I apologize for the background and the noise. And I'm wearing a t-shirt today because it's 87 degrees out here. I'm here for a few days on some business meetings. My name is George Fernandez. I'm the founder and CEO of Latino Connection. We are a social determinants of health marketing communications agency in Harrisburg. And we basically help community, business, education, and government entities understand and develop solutions to reach minority populations. Most recently, in partnership with Dr. Levine and Governor Wolf, we launched a health and wellness mobile unit that has reached over 10,000 plus minority community members across the state of Pennsylvania and have provided education on COVID-19 as well as COVID-19 testing and soon, hopefully, COVID-19 vaccinations. Thanks again for having me.
Great, wonderful. It's our pleasure. And finally, a big welcome to our own S.A. Olamhense, who is an investigative health reporter for Spotlight PA. Thanks for joining us, S.A. Welcome to the program. Tell us a little bit about some of your latest reporting.
Yeah, I'm S.A. Olumese, again, investigative health reporter. Very excited to be in conversation with this panel tonight. I'm interested in the vaccine rollout, all things vaccine at this point and COVID related. I'm really interested in finding out how people are navigating this process, if there are ways that it could be improved for them. I've certainly heard from a lot of people over the last several weeks and looking forward to hearing more today and in the future.
Wonderful, wonderful. Thanks for taking the time and joining us. I want to remind everyone, if you've just joined us, and we did receive a lot of questions in advance, and we'll try to work some of those in. If you haven't asked a question yet and you would like to, you can use the Q&A feature in Zoom. If you look down at the toolbar at the bottom, there should be a little button that says Q&A, and you can type the question in there, and I will moderate as we go and try to get to as many as possible. To start, Dr. Bushman, I thought it would be useful just to briefly explain to folks generally how the vaccine works, how it's different from others, and why it's considered safe. I thought this would be a good starting point just to kind of level set with the science. You know, one reader contacted us in advance, Forrest S, and asked how we can be sure there are no negative long-term consequences of the vaccine. Others have asked about the vaccine trials in terms of older Pennsylvanians, and I think there's still misconceptions, and we know there's misinformation out there, especially in certain circles online. So let's begin with the science and just tell us a little bit about how this works, what we know and what we don't.
Okay, I can fill that in very general terms. Maybe Eric Keel will want to step in and help as well. So when you're infected with any microbe, your body mounts an immune response. You produce antibodies which bind to the microbe and prevent it from replicating or do other bad things to it. And there are other kinds of pieces of your immune response as well. So if you're exposed to a part of a microbe or a part of a virus, then you can mount that immune response so that next time later down the road, if you're exposed to the real virus, you already have a lot of machinery in place, a lot of weaponry that can oppose that infection and make it harm you less or maybe not take hold at all. So that's the general idea of vaccination. Now, how do we know they're safe? Well, nothing's ever going to prove that something is 100% safe no matter what. But we can, part of the reason that vaccines are slow to develop and the rollout is slow and frustrating is that the testing is hard, that you need to really study it carefully in order to know if a vaccine is going to be safe or not. So what is it you do? You develop a vaccine and introduce that into some people, but maybe they get sick, maybe they don't. That doesn't necessarily tell you that much. You need another group of people who get a pretend vaccine, and then you can see, do the people who got the vaccine get sick or not? Does the so-called placebo control show about the same rate of illness or less? And in the vaccines we have for SARS-CoV-2, it was less. And then you don't do like 100,000 people the first day. You have to start slowly in case there's some rare toxicity. And then you increase the numbers on both sides, the test vaccine and the placebo. And you test. And as you start to see that the vaccine is protecting you from infection, and you know the infections are harmful and bad, and you're seeing few or no adverse effects, then you can start to say, gee, this is looking promising. You never prove it's safe. You just get to a point where you're highly confident that it's less bad than the disease, and then it's justified to introduce that into people. So we're well down that road. The various vaccines have been into a lot of people, and they seem to be, by and large, safe and effective. And I've not been vaccinated yet, but I'm looking forward to getting vaccinated.
Great. Eric, did you have anything you wanted to add?
Yeah, I think that's a great point. And we've heard a lot about how quick the vaccine went through the process, but I think it's important for the public to understand that a lot of the speed that was put in for the vaccine was going through the red tape of the federal government and approval in that. It wasn't in the testing end. It was not on making sure that this vaccine was safe, as the doctor just explained, but it was really shortening that time frame and allowing the federal government to consider all the tests that were done and having it get through that process far quicker than a normal vaccine or any other drug would go through that process. So when they talked about warp speed, that was the warp speed, not the issues around safety for that vaccine. And I think that's very important for people to understand. When they hear it was approved quickly, it was because the government approved it quicker than normal, not something that was done testing quicker or they didn't go through those appropriate processes.
Great, thank you. We've had a few questions, Jerry K, in the Q&A right now, and a few others about, okay, once I get the vaccine, I'm all good then, right? I can go back to my normal life, ditch my mask, hang out with my friends, but we know that's not true. So why is that not true? Can we talk a little bit for people who, you know, are looking forward to get it or maybe have gotten it? What do they still need to do, and why do they need to do that?
Well, shall I take a shot at that one? So
Sure.
The virus is changing. It's not one thing. This is getting to the variants that we brought up. So we're used to the idea that viruses change regularly with influenza. We have to get a new flu shot every year. That's because flu has changed. So we need to do everything we can to whack back the virus, reduce the numbers of people that are infected, reduce the amount of virus inside each person, so there's less possibility for new variants to arise. So we need to keep doing everything: wear masks, social distancing, vaccination, every weapon we can to really squelch down the virus, prevent new kinds from emerging, and thereby squash the vaccine globally. I think it was Tony Fauci who said, no one's safe till everyone's safe. We need to not only protect ourselves, our communities, all different communities in the US, but globally. Because, you know, suppose we're all protected in North America, but the virus is raging in South America. New variants may arise in South America and transfer to us. So we need to think about keeping every tool we have, holding the virus down, and then do so globally.
And Doctor or Eric or anyone else, what do we know at this point about how much someone can still spread the virus after they've been vaccinated? That's a question that's been asked in the chat here and was asked before the event as well. People wondering, how much of a spreader can I still be if I am vaccinated?
I'll let the doctor answer that.
Well, this is not an area I've worked in. I'm more studying the virus really closely than sort of population immune responses. But I think we're still trying to figure out to what degree can there be sort of little bits of replication left in someone who's mounted an immune response. Or maybe, you know, the vaccine works well. It doesn't mean it works perfectly in everyone. What if someone has a sort of marginal response and then gets infected? So I don't think it's ruled out that it's certainly not ruled out in all cases that people can become infected and spreaders even though they got vaccinated. That's part of the reason we need to keep up using all our tools, masks, social distancing, vaccination, everything. And all of those together, I'm highly confident we can whack back the epidemic long term. But we need to stay on it for now.
Great, thank you. I want to talk a little bit about the vaccine rollout situation here in Pennsylvania, and then come back around and talk about those variants and some of the research you're seeing, Dr. Bushman. So to start, Essay, I was wondering, a lot of your reporting and the reporting from other Spotlight PA folks has highlighted a lot of the obstacles for those who are considered at risk and are currently eligible to get a shot. Again, I want to emphasize here a big, part of this equation is the fact that there just isn't enough vaccine right now available. And hopefully that will change soon, and federal officials are indicating that may change soon. So putting that aside for a moment, Essay, what are you hearing as the biggest points of frustration within Pennsylvania, particularly among those who are currently eligible?
Yeah, I feel like I hear from new people every day about the difficulties they're experiencing. Some of it is related to technology. The state has a map tool and a your turn tool, but those are things that you would need access to the internet to be able to use. Of course, everyone isn't internet or tech savvy. So there's kind of a survival of the tech fittest thing happening where folks who are able to use the internet proficiently, maybe they're able to scrape information from a vaccine website or use other tools to advance themselves in the process, are able to do some of those things. To the frustration of seniors and others with limited proficiency or access to the internet. That's one issue. Another thing that we've heard from people is that materials around the vaccine, so these may be like tools like the map or the Your Turn tool or other kind of state resources around the vaccine, are only available in English. This ties back to the point that Dr. Bushman just made. It would be great, I think, if we vaccinated, the majority of folks who live in our state, but everyone doesn't speak English and everyone needs access to that information and to that material. But when stuff isn't updated as frequently in other languages, or when the information is harder to reach, people are shut off from that, and misinformation kind of jumps in to fill that void. So those are the two main challenges. Another one that I could list and that I've heard about more recently is transportation, where folks are able to book an appointment, the stars align for them. If you don't have a means of getting there, I spoke to a woman who doesn't have a working car. So her concern was, do I ride with someone else and potentially expose myself? Do I try to navigate transit and potentially be exposed in the process? What ways do I have to get connected physically to the vaccine? So those are some things I've heard. I'm sure, Eric and others have heard more. I'm interested in hearing more about some of that.
Yeah, Eric, let's turn to you for a moment. We know that the state has taken, I think the best way to describe it is sort of a patchwork approach. There's no centralized system to sign up for the vaccine and be notified. Instead, it's delegated down to all the different providers. They have their own systems, and there's been plenty of debate over whether that would be better than a centralized. Certainly other states have done centralized registries and had problems. We've seen the problems that Philadelphia had with the registry and system they had set up. But if we sort of set that aside, regardless, we know there's a lot of frustration, right? I mean, the current eligible group is folks who are older, folks who are at risk, and they're having trouble figuring out, not just getting it, but figuring out where to get it, how to get it, battling the systems. What are you hearing, and what have been the biggest roadblocks on your radar?
Well, Chris, I think it's important to understand how we got here, to understand why some of the concerns are there. I mean, really, in Pennsylvania, the vaccine first rolled out. We saw the Pfizer roll out the week of December 14th. And Pfizer needs, in their vaccine, it comes in quantities of around 975 vials in a pack. It needs a very deep freezer, almost dry ice level freezing. And we saw that in Pennsylvania go out to mostly your large health systems in your larger areas, just because they had the capacity to handle that. Your qualified health centers or your pharmacies don't have that capacity to, for the most part, don't have that capacity to handle something of that size, nor have the deep freezers to handle that. So the next week of December 21st, you started seeing Moderna come out, and they come out in packets of about 100 at minimum, and it goes out and can be stored in your freezer and any normal freezer that anyone would have. So that you started seeing that go out to your smaller hospitals and your federally qualified health centers. And that first month, that was really the first 4 weeks where we were vaccinating as FQHCs and others, health centers, were vaccinating folks on the front line that were in our facilities, as well as other healthcare professionals. And the state had estimated that was about 1 million people. And so while we were only getting the state was only getting about 143,000 doses a week, it was a little more manageable. And we were able to work with large dental offices and other healthcare providers to try to get all of their staff vaccinated at this single time. At the behest of the previous federal administration, in January 19th is when the state and the federal government pushed to open up that phase 1 to get to 3.5 million people. Now, I've heard it can be anywhere up to 4 million people, and that's where we added anyone 65 and over, as well as added individuals that have other comorbidities or other sicknesses. And that's where we really started seeing the struggle to get folks signed up and to access the vaccine. Because at the same time, or a day or two after, the federal government noted that they didn't have the vaccine supplies that they had thought were there. Whether that was production slowed or they didn't have the reserves. So we were still, as a state, only seeing about 143,000 doses a week. Now, on top of that, I think it's important for everyone to hear and understand, that was not including second doses. Second doses have been set aside. The state is prioritizing, and even today is prioritizing second doses. We are seeing an increase as a state. We've seen about a 22% increase in the number of doses we're getting from the government. It's up to about 174,000 or 175,000 doses that they received this week. But that still is going to take a long time to get to start vaccinating folks and to meet that 3.5 million number in that 1A area. I don't know what the right answer is as far as people getting registered. We certainly understand, and all of our health centers have phone numbers and they're taking phone calls. We had one of our smaller health centers on the first day that they announced the expansion take 4,000 phone calls in one day. We've hired additional staff on our front doors to help folks get registered. We're encouraging folks, if they do have access to the internet, to register that way. But I think most providers are taking those calls and trying to put folks on a wait list, because the number one priority is getting vaccine into people's arms. And that means wasting nothing. And we've seen very few, if there's any waste at all, most of that is somebody may have dropped the vial somewhere. We're seeing a lot of folks that are getting appointments in multiple locations and then not having a way to cancel their other appointments. And so for most providers out there that administer the vaccine, they have a wait list of folks that can get there quickly. We know transportation is an issue, just to make sure vials aren't getting wasted. So they always have a backup list of folks that may be able to get there rather quickly, because the first priority is to get vaccine into the arms of 1A. The second priority is not to waste any vaccine whatsoever. It is a precious commodity. And until the federal government can open up, and hopefully Johnson & Johnson was supposed to be being reviewed this week, which is a single dose vaccine rather than a a double dose vaccine like Pfizer and Moderna. Until we start seeing that coming through, that's going to hopefully boost a lot of the amount of doses that are out there and hopefully loosen some of this log jam that folks are experiencing. And we understand and appreciate their frustration. We're as frustrated as they are. We'd love 1 million doses and get them into everybody's arms and be able to find what that new normal looks like. It's just going to take some patience, and I think most folks would feel far more patient if they at least knew what day they could get their vaccine and be able to schedule an appointment, even if it is March 14th or whatever date that may be. But we're all working really hard to try to make that happen for everyone.
Sure, thanks. Let's go back to one point you mentioned, because I think this is important. We've gotten a lot of questions about this, and George, maybe you can chime in with your thoughts on it. But that is that expansion that Eric mentioned in January of 1A. You know, we at Spotlight, I know Essay, you can talk to this if you like, have just heard so much from older Pennsylvanians who are just asking the question of, why was this expanded before we were anywhere close, you know, getting to us, when we know, you know, we were some of the most at risk. We saw what happened in nursing home and other congregate care settings. You know, why was this opened up? George or Eric, I mean, do you view that as a mistake? I mean, what do you say to people who ask that question to you?
Go ahead, Eric.
Okay, George, thanks. From our understanding, and this is government at work. It was the federal government gave a directive to the state governments to expand that, and the thought process was to try to get as much vaccine out there as quickly as possible into the groups that were where the expansion led. And I think the federal government, and again, I don't have inside knowledge, I don't work for the state or federal government, but from our understanding is they thought there was going to be a lot more vaccine than there's turned out to be, or it was going to be generated a lot quicker. And we do know some of the manufacturers had some hiccups along the way. This is new to all of us. I don't want to couch it as a mistake, but it certainly could have used some more planning before it was pushed out the door. But it's something we're working through right now. And I know it doesn't feel that way for everybody. But again, we're as frustrated as the folks in our communities are. And we want to get that out as quick as we can.
Right.
I think it's important to mention that I personally am a believer that we're all swimming in new waters that we haven't swum in before. And I recall it took me a few years to learn how to swim because I was very afraid of jumping in the water. And I think that's really where we're at right now is our federal government is stretched beyond max. I think that everyone is trying to make the best decisions as quickly as possible. And there's so much we're currently in a landscape that's changing so quickly and so rapidly with COVID-19. And there hasn't been time to build a bigger runway. When an airplane's taking off, you know, it leaves all the way from the back of the runway so that it can catch that air, right? And we don't have that runway right now as it relates to COVID-19 vaccinations. In Pennsylvania, there's been a change in leadership at the Pennsylvania Department of Health. And I think that they too are doing the best that they can to make the allocation of those vaccinations available to those community health centers and the major hospital systems. Eric, we work hand in hand every single day with your FQHC partners, and they get up really early in the morning and they don't go home till much later at night than what they're used to because of how many phone calls and how much is happening. I saw one of the questions that came in was why isn't there a central place? And there isn't a central place because we haven't had that runway to build that strategy at the state level or at the federal level. So it's extremely frustrating. What I can recommend to folks is to keep calling those FQHCs, keep calling your hospital, keep calling your doctor, once a week or once every other week, and just keep checking in to see if anything is becoming available. I personally believe that we're going to be living in this new normal for quite some time. I don't see. I can tell you for sure that my Black brothers and sisters and my Hispanic American brothers and sisters are truly not going to be first in line to get these vaccinations. I personally will be getting the vaccination very soon. Hopefully here sometime in the month of March. I have a very bad chronic asthma and lung condition. And I work in healthcare, so I qualify under the 1A category to get the vaccination. So I'm a huge supporter of the vaccine. I too concur with Eric that a lot of the red tape is what was removed to bring the vaccine to market. But the quality of these vaccines were truly vetted at the federal government by the FDA and the CDC and many other credible organizations to be able to bring it to market.
George, in your work, can you talk a little bit about, I mean, we know, so there's one issue of, I want the vaccine and I can't find it or I can't get an appointment. There's another issue, I think, and there's a group of people who just still are a little uneasy about getting the vaccine for whatever reason, and depending on their background and experience, right, that may be, may have different thinkings about that. Can you talk about some of the common things that or concerns you hear from people in your work and how you respond to them?
Yeah, absolutely. You know, I think that all of us are responsible consumers in one way or another, whether we're buying a new iPhone at Best Buy or whether we're buying a television. We ask questions, and I think it's extremely imperative that we ask questions of those that we trust the most. I can tell you my mom has a crush on the pharmacy guy at Rite Aid, and she trusts him for some reason. So I said to Mom, ask questions of him if that's your trusting source, you know? So I think it's extremely imperative to encourage folks to ask questions of those that they believe are trust resources. And based upon the way that you feel after you have those discussions with those sources that you trust the most, you make that decision on your own. Perhaps you don't feel comfortable now getting the vaccination, but a few months from now, as your friends and neighbors and perhaps even old coworkers start to get the vaccine, you will feel more comfortable. But I think it's extremely imperative that we don't just go off of the busy TV ads and everything that's running on television. Let me give you a quick example. My mom has stopped watching television because she calls it loud noise. She feels that all the negative press and too much press around the vaccines is giving her a headache and it's making her concerned about COVID-19 vaccinations. So she's going to go ahead and find that trusted resource. I hope it's not the guy who checks her out at the pharmacy. I hope it's her doctor. But again, find that trusted resource and source that you feel comfortable with, and get those questions ready.
Great, thank you. Essay, I want to turn back to you. You've been a part of all the state briefings and keeping tabs on what the state's doing, how it's responding to questions. In the past week or so, what have been some of the biggest points raised by reporters reflecting, again, what they're hearing from the public with the health department, and how has the health department responded to those questions?
There is an incredible amount of frustration over the process. 1A expanding wasn't something that helped calm people's fears. Something unique to note about Pennsylvania, it's in the top, it's like the second or the third, it's on the list of states with the highest populations over 65, it's second or third. So that means we have a lot of wisdom in our state, but it also means that this 1A process can take a lot longer than it does in some other states. So that's something that's definitely frustrated folks. I see it in my emails, I hear it on the phone, and I'm seeing it in this chat. A lot of folks are upset that if you are a 16-year-old smoker in Pennsylvania, you can sign up and get the vaccine. A reporter did ask a question today about how hospitals and other systems are checking on the back end that someone is a smoker. If you smoked a cigarette once, does that qualify you? I think a lot of questions are arising about eligibility Now we have around 4 million people in 1A. It's going to take a lot of time. I think the folks at the Department of Health have a really difficult task. They do want to get people vaccinated, but the supply is coming in, it's like a trickle. And I don't think there are, even if we had a centralized system, which would, as Eric mentioned, reduce the kind of no-shows. Folks maybe book in 5 places and they show up to the first place that's able to get them in. But I think that even with a centralized system, it's not going to fix the supply problem that we have. Maybe when there is more supply, I don't know if that's something that the state might revisit. That's a challenge. There have also been a lot of questions about mass vaccine clinics in New York City, where I'm from. There's a clinic at Yankee Stadium and at the Javits Center. There are these large places that the state has worked with private businesses and other groups to have vaccination sites set up at, but we don't have that yet in Pennsylvania. The governor did say in a press conference today that they're working on that. He's meeting tomorrow with a bipartisan task force that will discuss this in some part. So hopefully we hear more soon about that. I know that will definitely or hopefully work to calm some people's feelings about all of this, but it's a frustrating time. And I think if anyone from the Department of Health is listening tonight, I can forward you, the emails that I get or the complaints that I get. People are struggling to, one, get and process this information. Even for myself as a journalist, I sit down in the morning, 8:30 or 9 in the morning to start my day. And by lunchtime, guidance and other things have changed. So it's a disorienting time. I sympathize with the health department. I also want to note today, for some of the older adults who may be listening, the State Department of Aging does say that it's going to be working with local aging agencies to help folks who need to call in because they don't have the internet or they're not as tech savvy, navigate this process and book appointments. So if you have there are 52 of these aging agencies across the state. If you have one and you are an older adult, I would recommend you call in your county. And if that doesn't work, contact me because I'd love to know how that's working.
Great, thank you. One other thing, Essay, I want to touch on, because I know this question came in from someone who's attending, but also we've seen it in some of the reporting. People are wondering, how is the state figuring out exactly how much each county gets, in these county allocations? And can you tell us kind of what we know or don't know about that process?
Yeah, we know population is the big factor, excluding Philadelphia, which has its own direct line of vaccine from the federal government. The state is allocating as much as it can based on population. Some of the allocation goes to long-term care facilities. They're being vaccinated through a pharmacy partnership program with the federal government that was in 2 phases. Phase 1 of that partnership was just for skilled nursing facilities, and then phase 2 or phase B, there are lots of different phase names at this time, is for other, maybe the DHS, Department of Human Services facilities and other long-term care facilities, and that's still underway. Of course, we know that folks at the Pennsylvania Healthcare Association and other groups don't feel like this is moving fast enough. This was something that was raised in today's press conference with the governor.
Great, thanks. Another question we've gotten in, probably good for Eric. Some folks are wondering, and I think, and perhaps you could talk about this, I think this is changing or will change. But some folks have wondered, how come I have to go, find a pharmacy or go to my Weiss or Wegmans or Giant, and they have it, but my doctor doesn't have it? Why can't I just go to my primary provider and get it? Why haven't they been prioritized since we have relationships with our doctors? Can you talk a little bit about how that's been and how that might be changing?
Sure. From our perspective, the state opened up vaccine administration initially through hospitals and through qualified health centers. And the unique thing with hospitals and health centers are we must take all comers. We provide care to everyone that walks through our door, no matter your ability to pay, whether you are a customer of ours, a consumer of ours or not. And we had to commit to, at least as to the health centers, we committed to at least 10%. And for most of our centers, it's far more than 10%, but at least 10% of that vaccine go outside of our customer base. And typically, at least for the health centers, We 1 in 4 Pennsylvanians are patients of our health centers. We serve 917,000 Pennsylvanians every year and more than 3 million visits. And the majority, 87% of those patients are on Medicare or Medicaid or underinsured or have no insurance at all or homeless. So we're really caring for that population that usually falls way behind, that doesn't have a primary care physician, and are usually more susceptible to these types of events, medical events. So with all of those factors, we believe that's why the state decided to roll out initially with those groups. On top of that, then in the middle of January, the state also decided the third leg of that was going to start rolling out and following the federal government's lead on a pharmacy program. Again, it's open to a greater percentage of the public than maybe a typical physician's office. My physician's office, mostly when they're doing flu shots, it's for their patients and it may be limited to just that. And the state has expanded to almost 1,700 providers that are able to administer vaccine, but almost less than half of them have received vaccine so far. So even though they're all registered, there's just not enough vaccine to go around. We do realize, and we've heard from the government the same way they did in their press conference today, but PEMA is working on large vaccination clinics, and they're hoping that once they get through all of the long-term care facilities, nursing homes, assisted living facilities, personal care homes, sometime in early to mid-March, and all the second doses, they can then reallocate all of those doses, those resources then to mass clinics. And so whether they're holding it at a place like the Wells Fargo Center or the Altoona Conference Center or somewhere across the state, there's been a lot of talk of maybe moving, once we have those resources, we can then reallocate those onto larger scale events. But right now their priority is trying to get long-term care. About half of their supplies are going into long-term care facilities, whether that's the staff or the residents who are typically in even a higher age of 74 to 84 years old or higher. And that's the biggest priority for the state right now. And remembering that this is not like the flu vaccine where it's one dose. So even though we're getting large amounts of the supplies, a lot of that is still second dose supplies. And as I said before, and the state continues to emphasize, and I've seen the question in here on the chat or the Q&A, this state of Pennsylvania is prioritizing second doses, and we believe that's the right thing as healthcare providers. There has been discussion on a national stage of doing just one dose and then leaving that second dose to go. That's going to be a lot more cost and lead to a lot more by the medical experts, at least here in Pennsylvania and others. That is not a path that the state of Pennsylvania is taking. So it's a priority. Our vaccines are going into those, make sure people get those second doses. So it's just going to take a while until we get through the long-term care facilities. And that, I think we all agree, should be one of the biggest priorities, because that's where a lot of these cases, and we've seen a lot of what could be avoidable issues in the future if we really focus on those groups first, and then we'll get back out into the communities and they'll be able to have a lot of those larger events.
Great, thank you. I want to turn back now to Dr. Bushman and move the conversation to variants. And just to set this up a little bit, variants now seem like they're in the news every day. There's all sorts of different kinds that people are hearing about: UK, Brazil, South Africa. And I think it's fair to say it's gotten to the point where it's a little bit confusing, and confusing to know which one, this one is really contagious, but the vaccine might cover it. We don't know stuff about this one. And I think people are having a hard time just sort of finding an even keel about this. So can you just sort of level set for people what we know is out there and how people should think about them and how sort of concerned they should be about each one?
Okay, so stepping way back, viruses are very sloppy when they make new copies of themselves. They make mistakes very commonly, and some of those mistakes are heritable. They're changes in their genetic material. And so all of their descendants will have this or that mistake, which was made by, the great grandparent virus, something like that. So the viruses are changing. And they're accumulating new changes in their genetic material. Now, there are millions of people infected around the world. There are millions of viral particles inside each person. There's really a lot of virus out there total. Now, sometimes these viruses move between humans and infect new humans. Sometimes they're squelched by an immune response, sometimes not. But you can start to see with all this change, if there arises a new variant that's more infectable, it can readily expand in the population and displace the other strains that are there. So that's what people are concerned about, that there are new variants arising that are better able to replicate inside people. And that's said to be the case for the UK variant. And there's good reason to think that that's true, because you can see around the world multiple places where the virus appeared and then expanded and displaced the other kinds of virus that were there. So it really looks like it's good at replicating inside people. And so if they spread more, maybe it's harder to suppress viral spread. There's much discussion about whether they may be more pathogenic. Are you more harmed by infection with these new variants? So far, there's not strong evidence, maybe a little bit of suggestion, but they seem to be maybe about the same. Now, this has happened a lot of different places independently, leading to all these named variants, the UK variant, the South African variant, the Nigerian variant. Many of these have specific genetic changes that we could sequence and read out. We do that in my laboratory. We've been tracking variants here in Philadelphia by sequencing viral genomes and sort of cataloging the kinds of variants we're seeing locally. So just in the last few weeks, we've seen the UK variant in several cases in Philadelphia. It's here and spreading in our population. We also see what some of the changes characteristic of different variants around the world, except appearing on new backgrounds here in Philadelphia. Some of the changes look like maybe they do help growth in people, and they're appearing over and over again. So this looks like it's a real thing. Unfortunately, we've seen a local variant in a vaccinated person, which looks like maybe it had evolved to elude the vaccine at least a little. So I think we have to be very aware of this, but it's not the end of the world. We're accustomed to these kinds of ideas from influenza. The first thing is just do everything we've been doing, wear masks, get vaccinated, social distancing, and so on to squelch the amount of transmission, the amount of total virus. That means new variants have less opportunity to arise and spread the more we do that. And then it may be that we do need to change the vaccine annually or at least once in a while. If new variants grow out that elude the old vaccine, we make a new one and protect people with that. And happily, the mRNA vaccines, for example, you can quite readily change and make target a new variant. Already they're talking about targeting the UK variant or the South African variant. And so, the technology is there to keep up with this. On top of that, another reason for being sort of optimistic is there's a very strong seasonal effect with coronaviruses. They tend to flourish in winter and go away to a considerable degree in summer. All the old ones that cause colds did that. Influenza does that. So coming towards this summer, if we can all, keep wearing masks, get vaccinated, I think we can squelch down the virus even with all these new variants and get to a better place. But we really need to focus on the basics: wear masks, social distancing, get vaccinated, and that works against everything.
Great, thanks. You touched on this in what you were talking about, but we've seen this in questions. And so based on what you're seeing so far with the variants, is there any major concern that, you mentioned there's one possible local example of a case eluding the vaccine. Are you seeing anything in the research now that suggests that could become more widespread, or are you generally seeing that, from what we know at this point, the vaccines are doing all right?
I think the vaccines are doing all right. There is some evidence that the South African strain can elude some of the vaccines that are being tried there. Both practically looking at how vaccination is playing out and laboratory evidence studying how the virus responds to different exposure to different antibodies and stuff. So yeah, I think it's a real thing. I think we need to keep a close eye on it and respond with altering the vaccine if we have to. But again, that's not the end of the world. We're doing that for flu regularly, and we know how to do that, and we'll do it if we have to.
And just, I mean, this is, I'm sure, very clear to you, but just to put a fine point on it for the listeners, based on what you and we all know now, what is the likelihood that COVID is something like the flu, that we sort of is going to be around every year, and we'll come up hopefully with a system as we have with the flu to get it to a manageable point? Is that basically what we know we're looking at now versus something that's just going to sort of totally go away?
It's hard to know. The first SARS did totally go away. We have SARS-2 now. SARS-1 seems to have totally gone away. If I had to guess, I'd wager that it's more likely to go to a flu kind of thing where we are altering the vaccine and it comes back at least a little each year. But I think it'll be quite a bit more manageable as we get more vaccinated and know more how to deal with it. But I could see it going either way.
Thanks. Essay, did you want to jump in there? Saw your hand.
No, I was just crossing my fingers at that.
As we all are, I think. That's great. Well, Dr. Bushman, you know, I think we can speak on behalf of everyone to say how thankful we are to have folks like yourself who are doing this work and doing it right here in Pennsylvania. I think that's really great and something we should all be proud of as a state. So thank you for that work. You know, I'm going to kind of think forward a little, and I'm probably thinking a little further than most people who are worried about if they're eligible, how to get the vaccine right now. But it seems, you know, with Johnson & Johnson coming online here, obviously we already have Pfizer, Moderna. We might get to a point, or maybe we're already close, where people may at a certain point have a choice or wonder if they should be making a choice between vaccines. Again, especially with this Johnson & Johnson one coming online. Is there any thought right now as to how people should think about that? If they came to you, doctor, with that question, what you would tell them, or would you basically just say, get whatever you can?
You're directing that to me. I would say get whatever you can. I think in the UK, they're beginning to talk about, well, maybe you get a first dose of one and a second dose of another. Maybe it's more convenient. It's good for the logistics. Possibly it might even work better. But what I would say to our listeners is get what you can when you can.
Eric, do you have any thoughts on if people start wondering, oh gee, if I have the option, which, you know, maybe as supply increases, we know, I think we all hope and I'd like to say we know, right, that things can only really get better. That there will be more vaccines. Hopefully there will be more of them. So it's not implausible that we get to the point where someone may eventually have a choice as to which one they get. What would you advise in that situation?
I think right now, Dr. Frank, I mean, it's getting a hold of what you can right now. I certainly, as we look at Pfizer, at the Johnson & Johnson coming out, it's being in one shot, and I think that'll go closer to your question earlier about why are our primary care physicians and doctors' offices not yet on the distribution list. I think once Johnson & Johnson gets here, we'll see a lot more in that phase 1B and phase 1C. And as we open up, it'll be a lot easier to manage one shot and having individuals come to their doctor's office, get a shot, not have to make second appointments and take up that timeline on a physician's office. And it'll lend itself more to large clinics and large groupings where we don't have to bring 2,000 people back on a Saturday 4 weeks later to get your vaccine. So there's a lot of hope on there. AstraZeneca is also very close and has, I believe, been approved in Britain and the UK. So that should be coming over to the US as well. So we're going to see some more supplies there. The other thing I think that's important is it's optimal to go back to your same provider to get your second shot, but not necessary. But it is very important to make sure you keep that card that you have. When you get your first shot, you get a card that says, here's the date I got my shot and what I got, whether it's Pfizer or Moderna. It's important to have that and to make sure wherever you schedule your second appointment is making sure you're getting that same vaccine in the second shot. And we've been advising folks, and a good practice, a lot of folks, to just take a picture of that card just so you have a record in case you lose it. I know I lose things all the time, but it's a nice way to at least have a record for yourself that I got the Pfizer vaccine or I got Moderna, here's the date. Because Pfizer, you've got to be back there within a specific time of 3 weeks, plus or minus a day. Moderna is 4 weeks, plus or minus 2 days. So it's not a matter of you can just blow off that second appointment and get it done 2 weeks later, as we tend to do sometimes with the dentist and others. It's going to be critical to make sure that that vaccine, and these double dose vaccines, at least from the data we've seen, are going to be better for folks in the long term. But that Johnson & Johnson, really, that's going to be that 65 and under and people that are generally healthy. That one shot's going to do enough to make sure you don't get the severe COVID, but you still may be getting it like it's a head cold or some minor issues and some minor symptoms from the Johnson & Johnson. And that's been shown in their testing, but still that's better than the severe symptoms, but it's not going to be as thorough as the double shots.
Great, thank you. We're just about at the end here, but I want to ask SA end on one point of a bit of accountability here, because we've gotten a number of questions about this, and I'm sure it's come up in the press briefings. But there is, there is a wonder, I think, among people, and I know there are some reasons why this might be, but folks are kind of saying, look, from early on in the pandemic, we knew a vaccine would be coming, or we assumed at some point we would get to one. I think we've gotten there sooner than a lot of people thought. But why wasn't the state able to do more pre-planning, kind of knowing this was a likely thing coming, to make the process, at least in terms of the information and the how to find where it is, et cetera. Didn't they have time to do that? It's not as though the vaccine arrived and it was a surprise. Have state officials addressed that question at all?
Not that I'm aware of. I'd love, of course, to hear that answer. I do know, again, we're in a difficult and uncertain moment. They have been publishing their vaccination plans. The last time we had one of these events, maybe 3 months ago, 2 months ago, they were on the first one, and now they're on the fifth, or maybe even the sixth one at this point. So a lot has changed, and a lot is changing quickly. I think in the future, books will be written about this moment, movies will be done. There'll be hearings. There'll be a lot of focus on this particular moment. I wish the state would answer that question. How have they prepared? How have they anticipated that there'd be large demand for such a finite supply? I think that those are important questions to ask. Other questions I still have are, what exactly is the mass vaccination plan? When will we know more of those details? What outreach is going to be done to communities once that is done? The state is expecting federal dollars, coronavirus stimulus money, toward a communications plan. When are we going to see some of that? How effective are the messaging models? Does the press conference model work? Should we be refining the ways we reach out and touch people? What's the backlog right now on vaccine providers? I know that at the beginning of the rollout, I spoke with pharmacists who said that they'd put in there, they'd been preparing to administer the vaccine since October. And then we got to February, we got to January, and they were waiting. So there are a lot of questions I think that are still left. I hope the next time we have one of these events, someone from the health department will join us. But I do think that that's one of the main questions at this point.
Great, thank you.
If I,
And
I know
sure,
you're
yeah,
close
real
to
quick.
add, but if I can add to that, it is hindsight's always 20/20, but to understand for the viewers out there, the state of Pennsylvania never touches a single dose of vaccine. This is all being shipped directly from the manufacturer per the federal government's orders. And the state has had their hands tied by the federal government from the start of this process. So they've not been told, they had to wait for the federal government to put a process into place to know how they could react and be able to move forward. Certainly there were things that probably could have been done ahead of time that maybe in hindsight should have been, but a lot of this falls on the federal government of not having a thorough plan and not knowing even when the vaccines were going to be ready. We knew they were in production, but how quickly were they going to be able to be ready? How quickly could they ramp up production? This is not one of those where you can turn a Ford plant into a vaccine production plant like we maybe did for ventilators or PPE or other things. It takes time for a vaccine to get produced, and how quickly that's going to go. And Pfizer and everyone else that is producing these vaccines are also getting these same demands from every other country in the entire world, asking for these vaccines and wanting these vaccines and purchasing them ahead of time as the United States has done. So those are all great questions. And with more runway time, as George put it, it had really been a much better process. And they are getting better. The federal and the state government are getting better at understanding, and they're starting to get into a rhythm of getting some consistency and letting the state know 2 to 3 weeks ahead of time how much vaccine they will have instead of 3 days ahead of time, which is why you're seeing lag times when the state reports we've received 1 million vaccine, but only 600,000 are in arms. It takes time till the state says we got an allocation on Thursday, and they let the FQH, the health center, know on Monday, and then it takes us 3 or 4 days to get that clinic up and running or to get those appointments done. So it's usually about a week lag time from the time a provider's told they're getting vaccine till they can get it into arms, because they don't want to do what's happening right now, which is having an event and then not having that vaccine and having to cancel, and that's even more frustrating.
Right. Thank you. And yes, as we wrap up here, I do want to note, because I think it's important and reflected in a lot of the questions we received from folks, that we did invite an official from the Wolf administration or a representative from the health department to participate, and they declined our offer. We're just about at the, or a little past actually, the end of our time together, and I want to thank everyone, especially our panelists, for a great discussion. While I wish we could end tonight telling everyone here exactly where to find the shot and how to get it, I hope we can all leave a little more informed. And if you're dissatisfied with the state's approach, or you think we can do better, I hope you're leaving empowered to contact your lawmakers or state officials and urge them to do better. Today's event was a free public service provided by Spotlight PA. And so this is the time I'd like to remind any of you who have not yet made a contribution and are able to do so, please go to spotlightpa.org/donate now. Contributions of any amount help us keep this programming free for those who need it most. And your support, as always, goes directly back into our journalism. As a member, you'll receive invites to special member-only events in addition to these public events we do, as well as updates from me giving you behind-the-scenes access to our reporting and how we're fighting every day to hold our officials and our government to account. Again, please visit spotlightpa/donate, spotlightpa.org/donate, sorry. Thank you again to Dr. Bushman, to Eric, George, S.A., all of you. I know you're incredibly busy right now, and I really appreciate you taking the time to answer our questions and the questions of our readers. I hope you all have a good evening, and go forth and be safe. Thank you all.